But basically, we're trying to create a new mechanical ventilator through this nonprofit without the aims of really making money. We're not trying to make like a 10x profit or anything like that. Just because we realize that there's a huge need for this.
Hi, I'm Dr. Weibo. Welcome to the Innovation in Medicine podcast. As an engineer and physician, I've always been interested in innovation in medical technology. In this podcast, I'll talk to doctors, engineers, scientists, and other leaders in medicine to gain their perspectives on the past, present, and future of innovation in medicine. One of the biggest hurdles during this pandemic has been the shortage of ventilators. In this episode, I'll be speaking to Varun Yarabarla, a biomedical engineer and a third-year medical student who currently works with a team of engineers and doctors in a not-profit company called Ventlife. And they're working to develop a low-cost ventilator to help with COVID-19 patients. They're currently raising money on an Indiegogo campaign, and they'd really appreciate it if you can support them. So the link and more information will be on the description. So here is my conversation with Varun. Welcome to another episode of this series, and I'm super excited to have Varun here with me today. And so Varun and I met in undergrad at Georgia Tech. We were both biomedical engineers, and had a privilege to have a few classes with Varun, and he's such a brilliant, smart guy. And I just remember when we were doing that was senior design. I remember what the group that he was in. They did a project, and I just remember that being one of the best projects in the class. And so I'm super pumped to have him in this program today, and we're gonna get started. So Varun, again, thank you so much for taking the time to do this with me and to just talk about innovation in medicine and to get your perspective on that. So I appreciate you taking the time.
Thanks, Ben. I appreciate you having me here. It's super inspiring what you're doing and helping the community spread the word on all this. So thanks for doing your part, and happy to be here. So like Ben said, I'm Varun Yarabarla. I'm a third-year medical student here, living in Johns Creek, Georgia. I graduated from Tech with Ben in 2016 with a bachelor's in biomedical engineering. And after med school, I took a year off, did a one-year research fellowship through Fulbright, where I did Alzheimer's disease research in Switzerland. And that was one of the most phenomenal years of my life. I highly recommend those of you who haven't had the chance to travel abroad or take some time abroad, it's totally worth it. Really lets you develop as a person and really gives you that chance and experience to grow. And after I came back, started med school, and yeah, here I am, almost in my third year. And just recently I decided that I'm probably going to pursue anesthesiology as the field that I want to go into. And I just got awarded another research fellowship for anesthesiology, and hopefully if everything goes well with this pandemic, or things improve, I should say, I hopefully will get the chance to carry it out and be at Harborview Medical Center with University of Washington this summer, doing traumatic brain injury research for based on children's results. So that's what I'm hoping to do at the end of the summer.
Wow, man. Well, first of all, congratulations
Thanks,
on
man.
all those opportunities. Clearly you have been through this journey for a while, and you have just taken every opportunity that's in front of you and, trying to make the best of it. So that's amazing, man.
Thanks, Ben. Yeah, I'm trying to do that.
Yeah. So, one of the common questions that I like to ask the people that I interview is, what is your definition of innovation for you, especially when it comes to innovation in medicine?
Yeah, no, that's a great question, to be honest. So I think a lot of people, when they think of innovation, they think of like some type of startup or some physical manifestation of like a product that you have to have like tangible. And I don't think that's always the case. I think innovation is just any improvement on an already existing concept, even if it's just an idea, just taking a concept and making it better than what it already is, especially in the field of healthcare where there's it's so vast and it's always developing and changing. There's always room for innovation, whether it's just improving waiting times at hospitals or finding ways to get medications out to patients more efficiently, or just donating like medically unused goods to countries that are in need. Just finding ways to improve things that already are existing and just helping the community. I think another aspect of medical innovation is humanism and empathy, hoping to improve healthcare and the quality of life for those in our community. I think that's one of the things that all physicians should strive for.
Wow. Yeah. Yeah. I completely agree with that. I think when I was younger, you know, when people talked about innovation, right, I just thought of people like Steve Jobs or, you know, the Facebook founder or Elon Musk and all those kind of people, right? And I
Right.
think as I grew up, I realized like innovation is literally improving one thing from where it is now to the next thing. And so I think we all have that opportunity to actually innovate every day in our life, right? And you can innovate
Exactly.
yourself even, right? It's like, hey, I was messing around yesterday and today I choose to do something productive with my life. That's literally innovation. So, you know, as you said, you don't have to do something grand and big. That's great if you have that opportunity, but actually we have those opportunities every day. And that's just powerful. So appreciate it. Thank you for that answer. That's pretty good.
Yeah, 100% agree with what you said. Definitely, you don't have to be anyone big or make some huge Nobel Prize worthy type of change. It's anything small that you can do. Anyone can do it, like you said.
Yeah, yeah. So you told us a little bit about your journey. You know, kind of how you came from high school to biomedical engineering.
Yeah,
Um, so can you kind of tell us a little bit more about that? How did you decide on biomedical engineering? How did you decide on medicine, and eventually to maybe lead us to the project that you have been doing recently?
sure. Yeah, so in high school, I wasn't really sure if I was going to choose medicine or business. Back then, junior and senior year, I was involved with a lot more business things. I did a program called the Young Entrepreneur Program through TIE, and it's like a newly funded thing, at least in Atlanta. And it's where a bunch of adults and like VCs and like business people put together an idea for high school kids to come and pitch different startup ideas. And so I did that for 2 years in a row, and I really loved and I thought I'd be pursuing business. I applied to business schools and engineering schools during my junior year, or for during my junior year to get into college and stuff. So I didn't really know at that point exactly what I was going to pursue. But then, kind of towards the end of my senior year, when I was hearing back from different schools, I my grandfather, he passed away from a brain stroke, and it was mostly because he was living in a rural part of India where he didn't have specialized healthcare, and that kind of really shifted my perspective and realized, oh, like maybe I can do more, maybe I have more emotional connection to the field of medicine, and that's where I started to think about pursuing medicine. And from that point, I was kind of choosing between Emory and Georgia Tech, and I didn't really. I applied to Emory's business school, and I didn't really apply for sciences, so I ended up going with Tech, just being in-state school, having Zell and not paying tuition. It just made it a really easy choice, and they have a fantastic engineering program. So just it, and as far as why I chose BME, it just really combines sciences and engineering and giving me that exposure to the medical field. So it was kind of like a culmination of everything that I really wanted. And it, on top of that, it kind of gave us that cushion in case we didn't want to fully pursue medicine after 4 years and we wanted to fall back on something. It's a great degree from a great university. It's always usually top 5 in the country for BME. So it really had its props and its perspective. So that's probably why I ended up choosing BME, and I don't regret it. Yeah.
Nice, nice. Well, also, sorry about your grandfather.
Okay. Yeah.
It's
Appreciate it.
definitely tough, and but all sometimes when bad things happen, some good things end up happening from that, right? And
True.
as you talked about how that situation inspired you to actually pursue medicine.
Yeah.
So like right now, as we all know, during this time we're going through this COVID-19 crisis, and you know, I think most of us are trying to do our best to, you
For
know,
sure.
take the situation and turn it into something, positive, because, so much going on. So can you
Right.
tell me a little bit more about, what you have been doing and what you have done to kind of take the situation in that similar way?
Yeah. Definitely. So the biggest thing is, like you said, everyone's been at home now, and hopefully everyone's taking the time to like relax and enjoy life and take it for what it is. Because I know every day, everyone, especially in the United States, day in day out, hour after hour, just trying to make a living, achieve the American dream, and it's not easy. Like it's hard work that you put in. But with this time, hopefully people are able to relax a little bit and realize things that we all take for granted. And so as I was doing that, something that really came to my mind was this project that I was luckily invited to join. It's called Ventlife. It's a nonprofit that was actually the idea originally started as a mechanical ventilator. Um, so basically, let me just start from the beginning, I guess. So we all know that with COVID, the biggest deficit is the lack of mechanical ventilators in the U.S. and especially in the globe. Like literally, countries in Africa, there's like one or two ventilators for the entire country in Africa, whereas like the U.S. has like thousands, and we're still in a deficit. So that just kind of shows you the disparity and the need of mechanical ventilators. And so, having seen that and having realized that, one of our prime members of the team, Glenn Meyerowitz, he used to be a SpaceX engineer for 5 years, and now he's a electrical and computing engineer at UCLA. So when he found out originally about this idea that there's a huge shortage of mechanical ventilators, he immediately started thinking, and he went out and bought some Home Depot equipment and put together a proof of concept for a mechanical ventilator. And from there, he kind of reached out and networked through his UCLA contacts at the biodesign field. And then he reached out to some doctors, and through all that, I kind of got spurred in. So my roommate in Jacksonville, where I was rotating for my third year rotations, he's actually a cardiologist, and he invited me on to the project just because of the knowledge that I have and experience that I have. So like having done those like two startup ideas in high school, doing BME, which is right up the alley for this, and then also being in the healthcare field and pursuing that in the future, it just kind of gave me like that full complete outlook, and they were happy to take me on, which I was grateful to take on because I had some time on my hands, so I was able to pursue this. But basically, we're trying to create a new mechanical ventilator through this nonprofit without the aims of really making money. We're not trying to make like a 10x profit or anything like that, just because we realize that there's a huge need for this. And healthcare workers across the world right now are in a tough position where they're triaging their care, and just because of the limited resources that they have, they're having to choose what patients deserve to live and who should die, and that's a position that's tough for anybody. So we're just trying to come out with a more novel ventilator that is a lot cheaper. A prime example is I think GM and Ventec came out with a ventilator that costs around $16,000 per ventilator,
Mm.
and the U.S. has budgeted a ton of money for that, and it I think I forget the exact amount. I think it's around I think the U.S. budgeted basically like around $1 million for the U.S. government has budgeted like around $1 million to buy 65 ventilators from GM and Ventec,
Mm.
and we're aiming and cutting our budget down to be about $1,000, so almost like 10x cheaper than what they're coming out with, and with the same money that the U.S. is trying to invest in them, they can get 1,000 ventilators at our model and still help 95% of the patients that their ventilator can help with. So it's just a lot cheaper model. And even if it's kind of a little late for us to make a huge difference in New York and these cities that have already been hit so hard, but we're doing our best to like roll out at a good pace. And it's hard to bring any medical device to market as quickly as we're doing. And so we're just working as hard as we can. And hopefully, even if we're too late for some of the cities, hopefully if there's a second wave, which hopefully there isn't, but if we're going to be ready for that, and even if not, hopefully the countries that need it the most around the world can take use and take part in our innovation.
Mm. Mm. That's good. I'm glad that you guys are doing something amazing out there for, especially for these places that are really in need of this, right? Because
Yeah,
when this whole started, you would think that the U.S. or especially these, more developed countries would be prepared for this, but we come to realize that things like ventilators are a scarcity out there. So I think this is definitely something that's needed. And how do you see this actually in the future? Because as you were talking about it, yeah, it might not be for just this COVID crisis, You talked about how African nations, like some, I know the country that I'm from in Tanzania, we only have a few ventilators in the whole nation.
Yeah.
And how do you see this type of technology actually influencing the future, especially in these kind of places?
Yeah, so that's one of our prime targets is we're doing these different hackathons. We just did one in Europe. Even though we're based in like in Los Angeles, we're trying to target and change our consumer market because we know that there are countries that could really benefit from this type of device and this model, and we're trying to innovate it and give as many features as possible so that they can use it for the good foreseeable future and they don't have to reinvest or buy another one, and they can sustain off of this idea or this concept. Just some of the ideas that we're trying to do. We're also like the world is also, especially healthcare workers, there's a lack of PPE. It's really
Hmm.
hard to get protective equipment. And so we're trying to innovate that and help save medical professionals that hassle. So one of the ideas we're trying to implement, even if it's not in our first prototype, but our second one, and moving on, we're trying to have a detachable UI so that the doctors can kind of take it off the ventilator and then have a wire kind of leading it to the outside so they can control everything for the patient from the outside of the patient room,
Mm,
and therefore reducing the amount of PPE that's always used. We're also trying to implement like Bluetooth adaptability, and come up with different tiers of models, because once you start implementing Bluetooth, the price goes up and the testing is a lot more different and difficult. Um, so we're trying to gauge and use different tiers of ideas as we move forward. But yeah,
mm.
that's our hope, is to help countries that really need it the most, even if we can't beat some of these huge companies that are trying to mass produce this summer.
Yeah.
We hope that we're ready for at least like a second wave, or even just help countries across the world.
Nice. And so, as far as that goes, where do you see are some of the challenges, I guess? Yeah, as you talked about, there is some competition out there, which is not bad, but there are some bigger companies who are trying to do things in a massive way. What are the challenges, just, maybe as a company, as well as you individually, that you face as a medical student, as you're going through this process?
Yeah, so every day I think we face roadblocks and challenges. I think that's like common for any. I mean, we're not a startup, but that's common for any entity that's trying to form, especially in the medical field. That's why every day we're working together and keeping each other updated on resources that we find. But I think, like you said, some of the biggest things the main thing we're having trouble with right now is funding, and that's always the biggest thing for any company starting up. Is once you acquire the funding, we already have so many different like ISO shops and manufacturers we have like 3 or 4 that are lined up ready to produce our ventilator on a mass scale, but they're asking for 500,000 or $700,000, and so
Hmm.
yeah, if we were like Tesla or some huge company, we would be able to just give that money pretty easily. um, we aren't in that situation. So it's been a challenge from that aspect, but we're doing everything we can. We've started an Indiegogo campaign. We've been hosted on like 11 Live News. We've gone on the radio a bunch, and we're just trying to get our name out there and like just spread our brand, and hopefully people will buy into the empathy that we're trying to convey, and hope that and understand that we're not trying to make money off of it, and just really bring about change. So that's kind of how we've been tackling it. We're doing these hackathons, and we're basically just using our skills because we have such a diverse group. Even though it's only 12 of us right now, all of us are pretty skilled in different things, and we're just trying to use all our resources and just find money any way we can to bring this to market. Once we get we're already doing clinical testing with the concept that we have right now at UCLA's David Geffen School of Medicine, their simulation center,
Hmm.
and so we've gotten good data already. So once we put that data together and we analyze it, we're going to put an IRB together and hopefully get it approved so that our device can be accepted. And once you have an IRB, things kind of move more quickly. And thankfully, recently we also got invited into University of Cincinnati's pre-accelerator program, and it's like an 8-week program where they kind of help us develop our idea further, and then at the end of it, we pitch it to a lot of companies, and hopefully we'll get some investing from that. It's kind of like an incubator.
Hmm.
So we're moving along, and we're all pretty happy with the pace that we're moving, especially for not having a ton of funding at the beginning. We're not really worried about the competition, just because of the resources that we have. I think we as a whole are happy with how we're performing with the resources that we do have. And our idea has been novel, and we're constantly changing and improving it to make it different. So even if it does go to market, I think the biggest selling point is that it's just a lot cheaper
Mm.
than what these other companies are making it for. So I think that's another huge selling point. And the fact that it even after COVID is over, you can use it. Originally, we were trying to do it, make it so that it's good enough for other respiratory things like acute respiratory distress syndrome and things like that. So there's a lot of different aspects to it that can really push us along and make our idea stand out even amongst those big name crowds. So that's the goal.
Nice, nice, man. Again, congratulations on just how far you guys have gotten. Because sometimes you can have an idea in your mind, right, and you never step out to actually execute that idea. So it takes
Right,
courage, right? It takes people right around you to support you. As you
for
said, you
sure,
guys have a team of people, so you need the right people around you to take that
definitely.
idea to the next level. So that's amazing, and super proud of you, man. I just hope for the best, that this would actually end up impacting so many people, and I'm honored to have you here for sure. So just to pivot a little bit, I wanted to ask you about wanted medical students and doctors and engineers and other different people to really know more about innovation overall. I know that's a blanket term, but how do you see a medical student as yourself, right? What kind of role can you play in these things? Because I feel like a lot of us, especially myself, when I was like in medical school, all my mind was just like, oh, I need to do well on, step one, step two, this. But then I never actually got in tune with my other passions, which is like, background with in engineering. I want to be able to innovate and do things. But what kind of advice would you give to medical students, and what kind of role do you think they can play in innovation?
Sure. Yeah, so like you said, like we talked about earlier, almost anybody can innovate. It's just about whether you carry out that aspiration and what you have in your mind. Yeah, as medical students, it's definitely tough because we're already stretched so thin as it is, just always focusing on school, grades, tests, exams, and like doing the best we can. But I think as medical students, even at least during third and fourth year, when you're in the hospital, I think it's a little easier to see what you're actually going to be practicing and see where changes and improvements can be made. And I think that's the time where you can really kind of pounce on innovating the things that you want to. I think the possibilities are limitless in that aspect, just because, like I said earlier, the field of medicine is so vast and it's growing every day. I personally think everyone should try to innovate at some point in their careers as aspiring physicians, just because um, it, you can do it in any way, right? Like we said, it doesn't have to be like a big idea or a big physical creation. It can even be like improving management or workflows within their clinic or their hospital on their floor between nurses and doctors, and just any type of small change that you can do to just improve the efficiency of your team or make patients feel happier and more at home. Just those small things, I think anyone can really innovate. And so I think it is tough as a medical student to just see that at all times. But I think especially during third and fourth year, when you're in the hospital, seeing what you're going to be practicing in the future, you have that ability to kind of connect more with that and resonate. And hopefully, I think that's when more people, if they want to, have the chance and opportunity to do so.
Yeah, yeah, I completely agree with that. I can tell you whenever I was on my rotations, and that's kind of when the engineering part of me kind of came back.
Yeah,
I remember having like an ENT rotation at Emory last year, and I was, going into the OR, and I could feel myself telling myself that could be better.
yeah,
Oh, we can do that better. Why did the patient take this long to do, that process? What can we do to solve these problems? And so I think whenever you have that, you're asking questions about everything. I think that's one of the things that you can do for sure, to
right.
become more innovative for sure. So I completely agree with that. And another question that I kind of wanted to hear from you as a medical student. This is more about the current situation. We talked about COVID-19 a little bit, but
Hmm.
how has this affected you as a medical student as you're going through your career? And how do you see this actually changing the future of medicine?
Yeah, so that's a tough question a little bit in terms of what I think. will happen in the future. But for me, like I said, my rotations have kind of been moved online. But I honestly think it's for me personally, my personal life, I think it's a blessing in disguise. I now am back in Atlanta with my family, staying at home with them, so I get to see them more. I'm taking time for myself and relaxing a little bit when I can, and just improving on the things that I want to and my passions and my hobbies. I don't think I would have been had the time or the opportunity to take part in doing these research opportunities or in a nonprofit like this if I was still on rotations in Jacksonville. Like it would have just been too much work and a lot to juggle. So I'm just really grateful for the time that I'm given. I know it's not under the best circumstances or the best terms, but I think if we're all just staying safe and staying at home, there's a lot that everyone can do to take their part and make a change if they really want to. I think that opportunity is there, and I think people should pursue their passions, just like you're doing, just like I'm doing. I think it's in anyone's best interest to make use of the time at home and really do that. In terms of changing the future of healthcare, or at least medical schools, um, I think, at least from my perspective, I think the schools realize now. I know not every single school in the country allows. Some schools have mandatory attendance, so I think that's a huge debate topic between faculty and students. Some students always argue that they prefer to study from home and do it at their own pace, and I think especially that's even more true for medical students when they need to budget the time that they see fit. So I think being able to do this, I think medical schools will see that students are still able to succeed from home, and hopefully maybe that'll be a driving factor and a changing force to change curriculum or the way faculty sees education and medical schools moving forward. So I think that's one change that could happen. I think as physicians, overall, future physicians, students need to be able to adapt. And I think this is a prime example of learning to overcome whatever happens, because as a doctor, you can't always predict what's going to happen. So I think it's a good testament to our ability and our future. And those of us who can work it out and persevere will do great.
Nice, nice. Yeah. That's great. Well, thank you so much for all those, amazing answers. And just I have two more questions left for you.
For sure.
One is, how can people support you and your current company, Ventlife? And then, just lastly, if you have anything extra to say, just feel free to finish up. So, yeah.
Cool. Yeah. Yeah. Thanks for asking that. We definitely appreciate the publicity. I think one of the biggest things is we just launched our Indiegogo campaign about 2 weeks ago. So, I mean, I can share that link with you, and if you don't mind sharing it, that'd be great. In order, if people could just donate, we have like shirts and like stickers and stuff. So there's definitely like perks to donating different levels. So whatever people can donate, we would really appreciate it. Again, we're not really trying to make money off of the idea. We're a nonprofit, so we're just trying to get enough money to build this ventilator and hopefully make a change in the world. So, thanks again for having me. So, sharing my story, sharing our story as a whole, I think
Yeah.
we really appreciate it. And I just want to say congrats, Dr. Webanelli.
Appreciate it,
You
man.
work super hard, and I'm super proud of you for everything you've done. So, thanks again for having me, and good luck to you too.
Yeah, yeah, dude. I will definitely share this, information, with people who will be listening, with my viewers. And, I just want to encourage people, as he said, this is not for not profit. Nobody's trying to make money from it. And, if something in your heart says, hey, I want to support this, please go out and support them in what they're trying to do. It's such an amazing cause. And it's something that clearly it's needed right now. And I know it might be something that's not affecting you personally, but it's affecting so many people out there. And as we talked about earlier, countries like, just where I'm from in Africa, something like this happens, it's not like they have the resources to control it, right? And,
Hmm.
maybe some of us are privileged enough to say we can stay at home, quote unquote, but,
Right.
there are some places that's not really the case. And so I just want to let you guys know that if you can support them, please go out and donate. So yeah, man, thank you so much again for taking the time. Definitely educated me. You definitely inspired me, and good luck with everything with the company. Good luck with the rest of medical school. You're almost there. Congrats again on your fellowship for the research, and I just can't wait to see what you're gonna do, not just now but in the future. So thank you, man.
Thanks, Ben. I appreciate it. Thanks for having me.
All right, my brother. Thank you for listening to this podcast. I would really appreciate it if you could rate, review, and subscribe for more content. Feel free to follow me on Instagram, and you can also find the video interview of this podcast on YouTube. See the link in the description. Until then, see you next time.